So there hasn't been that much media coverage about COVID-19 in children. And one of the reasons is because COVID-19 is less prevalent and less severe in children. The case fatality rate of COVID in the pediatric population is also less compared to the adult population. As a result, there are many misconceptions about COVID in children. So in this video, let's break down what we do know, and I'll try to best answer some of the most commonly asked questions when it comes to COVID in children. Are children immune to COVID-19? No, they're not immune, and this is why states have shut down schools. Children do have a relatively lower chance of getting COVID compared to adults. While about 22% of the United States population are children less than the age of 18, only about 2% of patients with COVID infection are children. About 90% of cases are the results of household and community exposure. The other 10% are cases that are associated with travel. In most cases, symptoms of children with COVID are similar to those of adults, which includes fever, cough, shortness of breath, nasal congestion or runny nose, sore throat, nausea, vomiting, diarrhea, fatigue, headache, body aches, meaning myalgias, and poor feeding or low appetite. However, children are less likely to present with typical COVID symptoms. In one CDC report, 73% of pediatric patients had symptoms of fever, cough, or shortness of breath, and this is compared with 93% of adults between the ages of 18 and 64 who had these same symptoms during the same time. Most of the children with COVID were asymptomatic or had mild or moderate symptoms. In a large study of over 2,100 pediatric patients in China, the data showed about 4% of patients were asymptomatic, meaning they had no clinical symptoms. They also had normal chest imaging, meaning a normal chest x-ray. About 51% had mild symptoms, so this includes fever, cough, fatigue, myalgias. About 39% had moderate symptoms, and they were including things like pneumonia on the chest x-ray. 5% of cases were severe, meaning they had shortness of breath, low oxygen levels. Some even had cyanosis, meaning bluish or purplish tint of the lips, the face. Less than 1% of cases were critically ill, meaning they had either acute respiratory distress syndrome, ARDS, or shock or respiratory failure and or heart failure or kidney failure. There are symptoms and complications of COVID that are more specific to children. One of the more severe complications is something called multi-system inflammatory syndrome, or MIS. So MIS-C, C stands for children. So MIS-C can present with persistent fever, inflammation, and evidence of single or multi-organ dysfunction like shock, respiratory failure, cardiac failure, kidney failure. Some children with MIS-C may present with symptoms of Kawasaki disease, and this includes things like fevers, red eye, body rashes, a sore throat, swollen hands and feet, swollen lymph nodes in the neck, red and dry cracked lips, and a strawberry tongue. While the links between COVID and MIS-C are unclear and are generally rare, dozens of children in New York City and Europe have been identified with MIS-C since the beginning of the COVID pandemic, and 3 deaths have occurred in New York City. In a statistical study done at Children's National Hospital in Washington, D.C., researchers found some interesting patterns of COVID-19 infections in children. For one, infants that were less than 12 months, and then older children, and this included the age 15 to 25, were more likely to require hospitalization. Also, these older children and young adults were most likely to receive critical care. Okay, number 2, children with COVID were more likely to have underlying conditions. The most common was asthma. However, children with asthma don't have a higher risk of hospitalization or being critically ill. Children with underlying neurologic, cardiac, hematologic, and oncologic diagnoses were more likely to be hospitalized. Still, these underlying conditions didn't make children more likely to be critically ill. Number 3, the only symptom that is more common in hospitalized versus non-hospitalized pediatric patients is shortness of breath. In contrast, minor symptoms like runny nose, sore throat, cough, headache, all of these are more common in non-hospitalized patients compared to the hospitalized ones. The data makes sense since respiratory support is a primary reason that patients with COVID require hospitalization. Okay, number 4, 94% of pediatric patients with COVID don't have co-infection with other viruses or bacteria. So of the 6% who had a co-infection, it was usually with enterovirus or rhinovirus. There's been no evidence of vertical transmission or direct transmission of the virus through blood from COVID-19 positive mothers to their babies. There's also been limited evidence that mothers with confirmed COVID infection can transmit the infection to their infants through the breast milk. However, the mother can still pass on the virus to the infants after delivery through respiratory droplets. The CDC recommends PCR testing for infants of women with suspected or confirmed COVID-19. The CDC also recommends physical separations of infants from mothers with confirmed COVID-19 at the time of birth. If COVID-19 positive mothers wish to breastfeed or have skin-to-skin contact with their infants, they should wear face coverings and practice hand hygiene. Children younger than 2 years of age should not wear face coverings, as this puts them at higher risk of suffocation. Testing strategies, including testing criteria and specimen types, are mostly identical for children and adults except for neonates, according to the CDC. So children who have symptoms and fall into any of the following groups should be tested. Number 1, if they have an underlying condition that may increase the risk for severe disease, such as congenital heart disease and other heart disease, asthma, an immunocompromising condition like HIV, former preterm infants, a neuromuscular disease with dysfunctional airway clearance, poorly controlled type 1 diabetes, and severe obesity. Okay, the second category, number 2, known physical contact with patients who had confirmed COVID within the past 14 days. Okay, the third category, if they present with severe illness, like if they have a new requirement for supplemental oxygen. Okay, the fourth category, if they're currently hospitalized, except for neonates in a neonatal intensive care unit whose mothers are negative for COVID. Children who have confirmed COVID-19 through lab testing can be managed at home if they are asymptomatic or have mild to moderate symptoms and they don't have an underlying medical condition that warrants them being in the hospital. Measures for parents whose children with positive COVID-19 status. This can involve 1, separating children with COVID from other family members who don't have COVID. Ideally, the affected children should have a separate room and isolated bathroom, if possible. Parents should also limit visitors to the house. Okay, the second thing is notify the pediatrician before the visits, which will help the pediatrician to better prepare for their visit. The third thing is keep COVID-19 positive family members away from pets in the household. Also, avoid sharing personal household items like dishes, cups, utensils, towels, pillows. Caretakers should wash these items with water and soap after affected children use them. Okay, the fourth thing is clean all high-touch objects and surfaces, including counters, doorknobs, bathroom fixtures, toilets, phones, keyboards, the mouse on the computer, tablets, whatever. Use a household cleaning spray or wipes according to instructions on the label. Okay, the fifth thing is if the symptoms or the conditions worsen, call your pediatrician right away. Some of these warning signs include things like shortness of breath or difficulty breathing, chest pain, having blue or purplish lips or face, and findings that are suggestive of shock, such as cold and clammy skin, confusion, or if the child is feeling very lethargic. So all children who have severe or critical symptoms are going to require hospitalization and supportive therapy like supplemental oxygen. Patients with MIS-C may require specialist doctors from pediatric infectious disease, rheumatology, cardiology, and critical care to manage the complex symptoms they exhibit. And of course, if you're not sure, a phone call to the pediatrician is the best thing. Hand washing with soap and water for at least 20 seconds. Hand sanitizer with an alcohol content greater than 60% is also useful. However, it should be noted that hand sanitizers should be out of reach of small children, as the ingestion of even small amounts of liquid hand sanitizers with the high alcohol content can make children sick. So practice social distancing, which means no play dates, avoiding team sports like baseball, and avoiding birthday parties with large gatherings. Children older than 2 should also wear face coverings if they have to encounter other people, such as the doctor's office or grocery stores. Teach your children to cough and sneeze into a tissue, or if they don't have a tissue available, into the inner elbow. That way they're not spreading the germs. Wash stuffed animals or plush toys according to the manufacturer's instructions in the hottest water possible before drying them completely. Clean and disinfect surfaces and objects at home using household cleaning sprays or wipes. If possible, teach your children to avoid touching their face, especially if they have dirty hands. Follow state and federal guidance on traveling and stay-at-home restrictions. So while children with moderate and severe asthma are at higher risk for more severe symptoms if they do get COVID, there's not enough evidence that asthma alone increases the risk of contracting COVID infection. Children with asthma should continue their medications regardless if they have COVID, because having good asthma control minimizes the chance of an asthma exacerbation, and there is no evidence that asthma medications can worsen the course of COVID infection. So children younger than the age of 2 years old, especially those receiving vaccinations, should continue to visit their pediatrician's office for their routine physicals and vaccinations. Parents of children older than 2 years old can ask their pediatrician's office whether a phone or an internet appointment can substitute for a physical appointment. For children over the age of 2 years old who have to visit their pediatrician's office physically, they should wear a face covering to minimize the exposure to the virus. Most children who contract COVID recover completely without any severe consequences. Very few children will go on to develop MIS-C or require hospitalization. The case fatality rate for children who contracted COVID was lower than 1%. The latest data from the CDC, as of the time of this video, was back in late May, and it showed that there have been 12 deaths due to COVID so far in children younger than 14 years old in the United States. The data also shows that there are 76 deaths due to COVID in the age bracket of 15 to 24. So this is much, much lower compared to older populations. Also, the younger the age, the more likely to have a better outcome if someone does have COVID. So of course, there's been a lot of news coverage about COVID-19, which can be frightening and overwhelming for both parents and children. The American Academy of Pediatrics has provided the following tips for parents to provide excellent communication between parents and their children through this challenging period. The first thing is simple reassurance. Let your kids know that many people, such as doctors and scientists, are doing as much as they can to keep everyone safe from COVID. The second thing is give kids the feeling of having control. Remind your children that there are things that they can do to help, such as washing their hands, coughing into their sleeves and elbow, practicing social distancing and getting enough sleep, and wearing masks if they're aged 2 and above. The third thing is to monitor signs of anxiety. Children may not express their worrying thoughts verbally, but they might do it through different behaviors, such as getting fussier, clingier, having trouble sleeping, or seem more distracted. Trying to reassure them and having a regular daily routine can help them through this difficult time. The fourth thing is to monitor media exposure and interpretations. Keep younger kids away from frightening images on TV and the internet. For older children, discuss together what they hear from the news and social media while correcting misinformation and rumors they may hear. But just for the record, if anyone's watching this channel, know that there will be no medical misinformation. The fifth thing is be a good role model. Children imitate adults around them, and your actions and behaviors are more effective than actual words. So hand washing, using hand sanitizers, not touching your face with food or dirty hands, and being kind to others and wearing a mask if they are older than 2 years of age, that's good. So thanks for watching this video. There are so many topics I want to cover on COVID and other medical topics as well. So subscribe to this channel, click on the bell so you get notified of when I make my next one, and I'll see you then.